Welcome. Healthcare for children, a terrifying to terrifying experience. Design thinking was oftentimes being described as an empathetical approach towards the question that how might we find something for people who themselves don't know what they need. At GE Healthcare, empathy was being needed to understand for how children experience CT, X-ray and MRI scanning procedures. The challenge at hand was how could one create a scanner experience for these children that they would love. So diagnostic imaging procedures are, as we know, a cutting edge technology, but at the same time they are a horrific experience for toddlers and also not so good experience for the elders. But right now the challenge at hand was to make the experience for children a little better. So this is a video or an image, I must say, showing the picture of a scanner which was installed in Pittsburgh University before design thinking was applied to it. And now, Dolch Knight is an industrial designer working with GE Healthcare for more than 20 years. Okay, he remembered that the first time when he saw a little girl who was crying on her way to the scanner that was designed by he himself, so it was kind of not so good experience for him also, but then it struck to him that the room itself was dark and was an unpleasant experience for a toddler or a young child who doesn't understand the severity why he's going through all of this. So this isn't not exact numbers or the right numbers, but it is just an chart which shows that already it is difficult time for the parents of the children who have to go through such scans or MRI or whatever. On top of it, if their child is not in a happy mood or is not collaborating, like not working with them, it becomes more difficult for children, it becomes difficult for their parents, and also it becomes difficult for hospital staff for handling these children because they don't understand the severity of the situation. So there was a need of brainstorming a way to find out how this experience can be turned upside down. Dodge Ditch tried to find new inspiration for his project. He also went to Stanford for a workshop. This workshop offered Mr. Dodge new tools that ignited his creative confidence. He learned about human-centered approach to design and innovation. He started by observing and gaining empathy for young children by going to different daycare centers. He also talked with child life specialists to understand the pediatric patients went through. He also did a few other brainstorming ideas and then came up with an adventure series scanner that would be able to be installed. The first such scanner or the prototype of this scanner was installed at the University of Pittsburgh Medical Center. It's in for the young children. It's in hospital over there. So, so application basically was small children, that's young children, I mean, toddlers do love animated characters. They feel comfortable around these characters and everything, right? So that was basically such same experience was tried to recreate in front of this young children when they enter into such rooms. Different themes were applied according to a child's uh, kind of liking. They were taken to such rooms. So it was a fun experience. It was like basically what they saw on their televisions coming to life, to say, not actually, but for them they felt so. So they were always excited. I will show you one video. In this video you can see that doctor is explaining the child, but you can see that he's tensed, he's not so happy to do this because he can sense the severity in the room and he's not happy with it. On the other, he's willingly so he's more towards this experience. In the previous video you could have seen that the child was little tensed, but your is not the same situation. Maybe this is they don't understand what they are going through. Only their families and parents understand. They are just living their dreams by going into some space machine or submarine. Is that sort of experience is created for young children. So yeah, so you can see different themes are applied according to different cartoon characters. Lights are made, some floors, everything is in coordination so that the kid feels most welcome. And see, here the issue was not just kid having a bad time, because of kid having a bad time, he was not very still in the MRI machines, so seductives were needed to be given to them so that a scan could have been taken. But if the child is having a good time, he understood that okay, if I'm still, only then I can go into the submarine. If that was told to them, then it was easier to take scans and everything. Also, if it is the seductives given to them was less, the child was having a good time, so it was not giving a hard time to their parents. And so that was one thing less worrying or concerning for their parents. Already they are in tense situation, and this one thing is less at least. And also it is a very big relief to the people who work in hospitals, the staffs, because it is every day with kids crying around. It gets used to, but then it's not a good experience for anyone. So this sort of experiment worked out. If you now see in medical hospitals, yeah, for young ones, you will always see such or on the similar basis type of thing. So that it's an experience enhanced for everyone. And Pittsburgh was the first one to let their MRI scanners and by GE do all of this. And yes, it was a win-win. And your design thinking was applied, that nobody knew, even the children or the parents didn't knew that what they needed for their experience to get better. Nor did anyone had thought of this before. But due to Mr. Dodge, this could happen. He also has worked in with GE for solving more healthcare related to children issues, to solve them basically. So this was one of them. Thank you.